I had a patient come in last week who looked absolutely terrified. She had been breathless for months, convinced it was just her getting older. Three different doctors told her three different things. One said asthma, one said anxiety, and the third mentioned her heart. She asked me, Doctor, how do I know what's really wrong with me? Here is the truth. Getting this diagnosis wrong isn't just frustrating, it could be dangerous. The treatment for COPD is completely different from asthma, which is completely different from heart disease. So today I'm going to show you exactly how to tell the difference between these conditions and most importantly, when breathlessness becomes a medical emergency. Hello, I'm Dr. Suman Paul, a consultant respiratory physician based here in the UK, and I have spent over the last 10 years helping people understand exactly what's causing their breathlessness. Now, before we go any further, I need to be very clear. I am a doctor, but I'm not your doctor. This video is for educational purposes only and is not a substitute for professional medical advice. If you are experiencing breathlessness, you must see your own doctor for proper evaluation and diagnosis. The problem is that breathlessness can be caused by dozens of different conditions. But today, we are going to focus on the four most common causes I see in my hospital and clinic: COPD, asthma, heart disease, and anxiety. Let's start with COPD, chronic obstructive pulmonary disease. COPD breathlessness has a very specific pattern. It's progressive, it gets gradually worse over months and years. My COPD patients often tell me, I used to be able to walk to the shops without stopping. Then I needed one rest, then two rest, and now I can barely make it to the end of my street. It's like a slow dimmer switch being turned down on your lung capacity. The five key signs of COPD are: number one, the breathlessness is worse with physical activity and gets better with rest. Number two, you have a chronic cough that produces phlegm, especially in the mornings. COPD patients often spend the first 30 minutes of their day coughing up phlegm and mucus. Number three, you have a history of smoking or significant exposure to air pollution or dust. About 75% of COPD patients have a smoking history, but 25% have never smoked. Number four, the breathlessness is there on most days, not just occasionally. It's a constant companion. Number five, you have frequent chest infections that take longer to clear away. A typical COPD day looks like this. You wake up coughing and bringing up phlegm. You feel okay at rest, but showering or getting dressed leaves you breathless. You plan your entire day around your energy levels. You avoid stairs. You have stopped doing activities you used to love. If this sounds familiar, you need to see a respiratory specialist. The good news is that with right treatment, we can significantly improve your quality of life and slow down the disease progression. Asthma breathlessness is completely different from COPD, even though many people confuse the two. The key word with asthma is variable. Asthma breathlessness comes and goes. You might feel absolutely fine one day and then the next day you can barely breathe. This is the complete opposite of COPD, which is there all the time. My asthma patients describe it as feeling like someone is sitting on their chest or like they are trying to breathe through a straw. The five key signs of asthma are: number one, the breathlessness is triggered by specific things: exercise, cold air, allergens like pollen or pet dander, strong smell, or stress. You can often identify a clear pattern. Number two, you wheeze. This is a high-pitched whistling sound when you breathe out. Not everyone with asthma wheezes all the time, but most will wheeze during an attack. Number three, your symptoms are often worse at night or in the early morning. Many asthma patients wake up at 3 or 4 a.m. early in the morning feeling breathless or coughing. Number four, your breathlessness responds quickly to reliever inhalers. If you use a blue inhaler and your breathing improves within 5 to 10 minutes, that's a strong indicator of asthma. Number five, you might have other allergic conditions like hay fever or eczema. There is often a family history as well. A typical asthma experience is like this. You feel fine most of the time, but then you are exposed to a trigger. Maybe you go for a run in cold weather or you are around a pet and suddenly you are breathless and wheezing. You use your reliever inhaler and within minutes you feel better. Here is a crucial difference. Asthma is reversible. With the right treatment, most people with asthma can live completely normal lives with no symptoms. COPD causes permanent damage that we can only slow down and manage. This is the one that catches people off guard. Many people don't realize that heart problems can cause breathlessness that feels exactly like a lung problem. When your heart isn't pumping efficiently, fluid backs up into your lungs. This is called pulmonary congestion or heart failure. Think of it like a traffic jam. If your blood can't move forward efficiently because the heart isn't working properly, it backs up into your lungs. This fluid makes it harder to breathe. The 5 key signs of a heart-related breathlessness are: number 1, the breathlessness is worse when you lie flat. My heart failure patients need to sleep propped up on 3 or even 4 pillows because lying flat makes them feel like they are drowning. Number 2, you wake up gasping for air in the middle of the night. You have to sit up and stand up to catch your breath. Number 3, your ankles and legs are swollen, especially by the end of the day. You might notice your shoes feel tight by the evening. Number 4, you might have chest pain or discomfort, especially with exertion. This is a serious symptom that needs immediate medical attention. Number 5, you feel exhausted all the time, even after a full night's sleep. A typical heart failure day looks like this. You feel okay in the morning, but as the days goes on, your legs swell and your breathing gets worse. By evening, you are exhausted and breathless. You can't lie flat because you feel like you are suffocating. You wake up gasping for air at 2 a.m. in the night. If this sounds like you need to see a doctor urgently. Heart failure is serious, but with modern treatment, we can significantly improve your symptoms and life expectancy. Now, I need to address anxiety-induced breathlessness. Just because breathlessness is caused by anxiety doesn't mean it's all in your head or that you are making it up. The breathlessness is real, the distress is real, and it needs to be taken seriously. The 5 key signs of anxiety breathlessness are: number 1, the breathlessness comes on suddenly, often within minutes, and is associated with panic or dread. You might feel like you are having a heart attack. Number 2, you are breathing rapidly and taking quick, shallow breaths. This is called hyperventilation. Ironically, you are getting too much oxygen, which causes tingling in your fingers and dizziness. Number 3, your symptoms improve when you are distracted or when you focus on slow, controlled breathing. Number 4, you have other symptoms of anxiety: racing heart, sweating, trembling, nausea, or a sense of unreality. Number 5, all your medical tests come back normal. Your oxygen levels are fine. Your chest x-ray, CT scan of chest, your heart test, all are normal. If this is you, please don't feel embarrassed. Anxiety disorders are incredibly common and very treatable. But don't let a doctor dismiss your symptoms as just anxiety without doing proper test first. Now, when does breathlessness become a medical emergency? This is absolutely critical. Call 999 or go to A&E immediately if: number 1, you have sudden severe breathlessness that comes on within minutes or hours. This could be a blood clot in the lung or collapsed lung. Number 2, you have chest pain along with breathlessness. This could be a heart attack. Call 999 immediately. Number 3, you are coughing up blood. Number 4, your lips or fingernails are turning blue. This means your oxygen levels are dangerously low. Number 5, you are so breathless that you can't speak in full sentences. Number 6, you feel confused, drowsy, or like you might pass out. Number 7, you have high fever above 38 degrees Celsius along with breathlessness and cough. This could be a pneumonia. When it comes to breathlessness, it's always better to get checked out and be told everything is fine than to ignore something is serious. Let me summarize the key differences. COPD, progressive gradual worsening. Chronic cough with phlegm. History of smoking is quite common and the symptoms are present on most days. Asthma, variable, comes and goes, triggered by specific things. Wheezing, and it responds quickly to reliever inhaler. Heart disease, worse on lying flat, wake up gasping at night, swollen ankles, may have chest pain. Anxiety, sudden onset, rapid, shallow breathing, associated panic symptoms, and all normal medical tests. If you are experiencing breathlessness, the most important thing you can do is to see your doctor for proper investigation. Don't try to diagnose yourself based on YouTube videos, not even this one. What I hope I have given you today is the knowledge to have an informed conversation with your doctor. You can now describe your symptoms more accurately and understand the key differences between these conditions. Remember, most causes of breathlessness are treatable. With the right diagnosis and treatment, most of my patients see significant improvement. You don't have to live with breathlessness, there is help available. If you found this video helpful, please like and subscribe. Thank you for watching, and remember, always see your doctor for proper medical advice.